If you get sick or somebody in your family gets sick, where do you want to go?
Take me to Ruleville.
I would tell them, take me to Ruralville.
Take me to Ruralville.
That's a catchy slogan. Take me to Ruralville. The idea behind it is when you need health care, you want to be taken where there are attentive doctors and nurses and a hospital staff who really care about you as a person, where you're not just a number on a chart, but you're someone to be looked after. And people really do prefer to come to Ruralville, to the North Sunflower Medical Center. Well, now they do. The Mississippi Delta is every bit as much a feeling, a spirit, an emotion, as it is a place. And it's been lauded as well as lamented in song and literature and poetry for as long as people have lived here, extracting cotton and corn and soybeans from the Delta's vast alluvial acreage of buckshot soil. Proud people built the Delta, hoeing its fields and tending its cotton gins, and now many of them have become displaced in their own homeland as agricultural practices changed from manual labor to mechanization. They became obsolete. One person on a tractor can do the work of 100 plowing with mules or hoeing by hand, and one person in a crop duster can replace 1,000. As a result, the little towns that were once the jewels of the Delta, teeming with hardware stores and lumber yards and grocery stores and car dealerships, dried up and blew away over the decades, just as obsolete as the human-powered farming culture it used to serve. And facilities like the North Sunflower Medical Center were going right down the same path behind the towns. That was the condition here a decade ago.
We had about 8 hours of cash on hand with a lot of debt, no patients, and I didn't know that we couldn't do what we did.
Billy Marlowe was appointed administrator of North Sunflower Medical Center shortly after becoming a member of its board of directors and a rapid rise to chairman of the board. It was a desperate time for North Sunflower. But looking at the facility today, obviously it didn't go under. Not only did it survive, it thrived.
I did a survey. The first thing I did is tell me what's wrong, tell me how to fix it, and really the employees fixed this, because I just took their ideas and ran with it.
Evidently some good suggestions came from that survey. The place was remodeled and modernized and updated and added on to, and then went on to become state-of-the-art in many instances.
He treated us like a business. He treated us like a family. And he gave the employees wings to step outside the box. And he's a risk taker, and that's what it took.
Employment went from a little over 100 back then to over 500 today. Now keep in mind, this is in an area of the country where unemployment is normally what rises. And the little hospital that thought it could started to attract attention, and for good reasons.
The nurses and the whole staff are just so attentive to all of your needs. The place is beautiful. It's gorgeous. It's like being in a hotel.
Everything's been perfect. It really has. The people, the equipment, the doctors, nothing could be changed about it. Everything's just been wonderful.
We're so fortunate to have something local like this.
Life could have ended up being a lot different for Essie Magic without the Diagnostic Center's state-of-the-art mammography and caring technicians.
I ain't have nobody like that before till I met Nancy. And like I say, she took me through everything and told me what the situation was and talked to me and held me. We cried for a little while. She shed tears. And by the grace of God and by the help of Nancy, everything went good.
As word spread, people really did start telling their relatives, if I ever need a hospital, take me to Ruralville.
Somebody was telling me, they said Cleveland Hospital is a little bit bigger, but you get the better service here in Ruralville.
In the Mississippi Delta, there's no such thing as too many medical facilities.
The Mississippi Delta, Sunflower County is one of the poorest counties in the state of Mississippi, in the country. Highest diabetes, obesity, cardiovascular problems, and so we think we are doing a good job by bringing health care to them.
And even though there may be other facilities as close as 10 miles up the road, in a place where poverty is as prevalent as it is in the Delta, 10 miles away might as well be 100 or 1,000.
There's a lot of people that are going without getting treated for simple stuff because they have to travel so far to get it done. And you know, we're able to start providing a lot of those services right here.
There are people here, like Wayne said, they can't go anywhere and get health care. They have to pay somebody to take them.
And now that the North Sunflower Medical Center is firmly back on its feet healing the people of Ruralville, now it has turned its attention to healing the town of Ruralville, to bring it back to its former glory. Not like it used to be with hardware stores and lumber yards, but as an entirely new invention, a medical mecca.
We want to see Ruralville be the healthcare hub of the Delta. And we want specialties. We're bringing specialties in now. And we have clinics downtown to try to revitalize downtown and the whole town.
That goal's already being attained with the North Sunflower Medical Center adopting many of the old dilapidated downtown stores and renovating them and installing new medical facilities in them.
We have Sunflower Dental Clinic, Sunflower Eye Station, the Diagnostic Center, which is digital mammograms, which is, there's only one other machine in the state that is good as our mammogram machine. That's in Tupelo, Mississippi.
And now, Little Ruralville, a village that, like many of its counterparts, was wilting back into the Delta dirt from which it sprang, is growing again and has facilities in its medical center that are the envy of facilities in much larger cities.
Every time that I've had a physician tour through our surgery center, the first words that are out of their mouth when they walk into our surgery center is, wow.
All because they didn't know that it couldn't be done? Well, partly, but more because they knew it had to be done. Because this facility has to be here, and has to be as good as it is, and consistently improving. Because the hard-working folks who built the Delta deserve it, and are proud of it, and proud of what it's done for their town, and proud of what it's doing for them personally.
I'm proud to be a member of this town and get up on it every morning, sit there and get my coffee and ride around, see the hospital, see the improvement, see Mr. Guilbeault at the new pharmacy there and everything from Drew. It's just amazing. It really makes me feel good. It makes me feel good, yes sir.
So, Take Me to Ruralville is more than a catchy slogan. It's a rallying victory cry for a region of the country that's been down too long and is on the mend, thanks in large part to this hospital, and would be in no telling what condition without it.
Take me to Ruralville.
Take me to Ruralville, back to the folks I know. Let's get moving. Ooh, we better be up and gone. Take me to Ruralville, where I can feel at home. Take me to Ruralville, where I feel right at home. Take me to Ruralville.